My name is Diana Azzam. I'm an assistant professor and director of doctoral programs in the Department of Environmental Health Sciences at the Robert Stemple College of Public Health and Social Work at FIU. One area is to provide individualized treatments to cancer patients that have exhausted standard of care. We do this by testing hundreds of FDA-approved drugs on the tumor sample that we receive from the local hospitals that we work with. And we perform high-throughput functional drug testing, which is basically testing of hundreds of FDA-approved drugs on the tumor sample. Our feasibility studies were done funded by the state of Florida Live Like Bella Pediatric Cancer Initiative in collaboration with Nicklaus Children's Hospital, generated very promising results. We found that children with advanced cancers that were guided by functional drug testing and genomic profiling have improved survival compared to those patients that did not go through our functional drug testing and genomics. Ideally, we want to provide individualized treatments for patients that have newly diagnosed cancers, so we avoid the toxic, trial and error of drugs. But in order for us to get to that point, I believe we need to generate data from large-scale clinical trials that will prove that drug testing correlates with improved outcome. And so hopefully in the future, this would be something we could use upfront for patients with newly diagnosed cancers. One interesting observation from our feasibility studies here at Nicklaus Children's Hospital is that the majority of the patient population are minorities, so they're Hispanic or Black African Americans. And what we found is that they respond differently to FDA-approved drugs, and they have completely different genomics than other ethnic groups. And so I just received an NIH-funded study to basically identify biomarkers that are specifically expressed in minority populations and identify targeted drugs that may work within the specific population. The other aspect of this is we will be providing functional precision medicine clinical trials to children with cancers that come from minority population because they usually don't have access to these clinical trials.